My dear doctors, so today I'm going to continue with our MRCP PACES consultation station, and I'm going to talk a bit about the post-polio syndrome. This case has appeared in MRCP PACES consultation station. Normally this case is more prominent in the Asian centers, like maybe it can present in India, Malaysia, Pakistan. Um, so it is very important for the candidates who are appearing in the Asian centers. So let's move on with our case. So this is a case scenario. So you are a physician in an outpatient clinic, and Mrs. Johnson, a 65-year-old woman, presents with new onset weakness and fatigue. Over the past year, she noticed a gradual decline in strength and increased difficulty with walking and daily activities. She reports no recent infection or other significant health issues. So I've highlighted the buzzwords here. So once you read this scenario, then you already have an idea that this consultation station is mainly um, concerned with neurology, and the patient has some weakness and fatigue, and there's a gradual decline. So gradual decline means this something which is chronic is going on, and then they have also given a clue that there is no recent infection or other significant health issues. Okay, let's move on with our case now. So as when you go into the consultation room, first of all, as usual, that I have told you last time as well, that you are going to do the introduction, going to greet the patient and introduce yourself, confirm the patient identity. Well, it is not needed actually. Briefly explain the purpose of the consultation. Um, so how are you going to explain the purpose of consultation? You can just start by saying, my name is Dr. Whatever is your name, and I'm one of the doctor working in the hospital, and today I'm going to talk a bit about your complaints, and then it will be followed by some examination, and then I'm going to answer any queries or questions from you. So this is how you're going to do a brief introduction. So we start with the history taking. I put here, we're going to ask about the past history of polio. Actually, this question maybe you can put in the end, but once you enter the station and you see the patient has some, patient is just sitting, and usually sometimes the lower limbs will be exposed, sometimes they're not exposed. So if they're exposed, then you can see, like I put here in the picture, there is some wasting of one of the limb. So you'll be thinking about all the differential diagnosis. So then we are going to explore the current symptoms like weakness, fatigue, and any changes in an ability to walk or perform daily activities. We're going to ask about the time of onset and progression of the new symptoms. We're going to investigate any recent infection, trauma, or other stresses that might have triggered the decline in strength. And finally we want to assess the impact of symptoms on Mrs. Jones' daily life and any associated pain or discomfort. Remember, don't forget this very important point in the history. Always ask about the impact of symptoms on daily life. We're going to proceed with the systemic review. So systemic review to identify any of the relevant symptoms or medical issues. By systemic review, I means just few questions about the different symptoms, different systems. Like for the respiratory system, just ask about any difficulty in breathing. For the cardiology system, ask about the any palpitations, chest pain, any peripheral edema, and similarly covering the GI system, ask about any vomiting, diarrhea, and weight loss, and finally the CNS, briefly about any visual disturbances or any imbalance, any walking difficulties. So this is how you're going to do the systemic review. Specifically, we want to inquire about the respiratory system, as any because and any changes in the Mrs. Johnson's breathing. So this system is very important. So after you've taken your history, then you will take the consent, and you will start with the general physical examination. So first of all, we're going to do the observations. So ask the patient, observe the patient and notify any signs of muscle weakness, any altered gait or use of the assistive devices. So these are the important things that, or you look for any altered gait and some, maybe some crutches are there or some wheelchair is there. And then general appearance, assess for any signs of fatigue or respiratory distress. So just getting some idea with the inspection that whether the patient has having any breathing difficulties or patient is comfortable at rest. Then you move on to a neurological examination. So on inspection, you're going to see some wasting. As I have, you can see there's a marked wasting in one of the leg. The other leg is okay. So in the neurological examination, we're going to do the muscle strength. So normally the positive findings includes new weakness, particularly in muscles affected during the initial polio infection. We want to do the muscle bulk and tone, and positive findings are muscle atrophy in the affected muscle group, and there is signs of decreased um, muscle tone, and then the gait and balance. So changes in gait such as slower walking speed, increased effort. So all these things uh, you can see there. Just give me a moment to settle this one. We're going to do the joint examination. Presence of any joint contractures or deformities due to muscle balance, and finally the reflexes. Normally we'll expect some hyperreflexia, especially in previously affected muscle groups. And the sensory examination, typically the sensory examination is normal unless there are any coexisting conditions. So this is important point which you should always remember. The sensory examination will be normal. So this is your brief neurological examination of the lower limbs. Then we'll move on and we want to do the respiratory examination as well. Assess the respiratory rate and effort, check for the chest expansion, auscultation, listen for any abnormal breath sounds, and the positive findings are usually there's maybe some signs of respiratory muscle weakness such as decreased chest expansion or abnormal breath sounds. So what are the positive findings which will be there in the post-polio syndrome? Muscle weakness, new weakness, particularly in muscles affected during the initial polio infection. There may be muscle atrophy, which are signs of muscle wasting or atrophy in previously affected muscle groups. Gait abnormalities, changes in gait such as slower walking gait, increased effort or altered balance. Joint contractures, hyperreflexia, increased reflex activity, especially in previously affected muscle groups. Respiratory muscle weakness, like signs of respiratory muscle weakness such as decreased chest expansion or abnormal breath sounds. And functional limitations. Patient reports increasing difficulty or dependence in performing certain activities compared to baseline. So it's actually, you will this one will be apparent on the history. So patient will give the history that the patient has childhood polio and then everything was going on smoothly, but suddenly there has been increased weakness, and sometimes post-polio syndrome is associated with pain as well. So remember that if the patient has pain and the weakness has increased, there is a previous history of polio, then you must be thinking about post-polio syndrome. So let's talk a bit about the differential diagnosis. So whenever the patient presents with some muscle atrophy, there are a few differential diagnoses which you must have in your mind. And the examiner may ask you about the differential diagnosis. It's good to have at least 4 or 5 differential diagnoses. Muscle disorders like muscle dystrophies, this is inherited muscle dystrophies, and these are characterized by progressive muscle weakness and wasting. And inflammatory myopathies like dermatomyositis and polymyositis, autoimmune disorders affecting the skeletal muscles. Neuropathies like peripheral neuropathies, conditions affecting the peripheral nerves like diabetic neuropathy or Guillain-Barré syndrome or Charcot-Marie-Tooth disease, which is a hereditary neuropathy affecting the peripheral nerves. Then other differential includes like spinal cord disorders, spinal cord compression, we know that compression of the spinal cord due to conditions like disc herniation or spinal stenosis, amyotrophic lateral sclerosis, which is a progressive neurodegenerative disorder affecting the motor neurons, orthopedic conditions like osteoarthritis, degenerative joint disease causing pain, stiffness, and rheumatoid arthritis. So remember, these are the main differential diagnoses, and always divide into different groups. Like I put here, muscle disorders, neuropathies, spinal cord disorders, and then chronic fatigue syndrome. This is characterized by persistent unexplained fatigue and other symptoms, although the wasting will not be there. Fibromyalgia, which is characterized by widespread skeletal muscle pain, fatigue, and tenderness in local. Vitamin deficiencies can also cause some weakness and fatigue. And endocrine disorders like hypothyroidism, and chronic infections like Lyme disease or persistent viral infection, metabolic disorders, um, and finally medication-induced neuromuscular symptoms, because certain medicines, as you're aware, may cause weakness or fatigue as side effects. So you can put these differential diagnoses, but for me the most important will be the muscle disorders, neuropathies, and spinal cord disorders, considering this patient, because patient has some wasting apparent. Chronic fatigue syndrome, fibromyalgia, although they can cause some fatigue, but they will not cause wasting. So how we will diagnose with the patient with post-polio syndrome? We can do the EMG and nerve conduction studies. While it's not necessary for diagnosis, but EMG can be supportive by demonstrating characteristic findings of chronic denervation and re-innervation in affected muscles. Imaging studies are important. MRI, CT scan useful. They are not specific for post-polio syndrome and may be used to rule out other structural causes of symptoms. Laboratory tests, blood tests can be conducted to rule out other potential causes, such as inflammatory markers for rheumatological conditions or tests for metabolic disorders. And pulmonary function tests, which assess the respiratory function, as respiratory weakness can be a component of post-polio syndrome. So normally it is diagnosed with the history, but these are all tests which are done to rule out other conditions. Briefly about the clinical criteria. Consider the clinical criteria for diagnosing post-polio syndrome, which includes previous paralytic poliomyelitis, a period of functional recovery after polio, and then we have gradual or sudden onset of new weakness, fatigue, or pain, stability of symptoms for a period of at least 15 years, and then exclusion of other potential causes. So this is the clinical criteria for the post-polio syndrome. Briefly about the management of post-polio syndrome. Normally it is aimed at improving and maintaining the individual's quality of life by addressing symptoms and maximizing the function. So it always, remember this multidisciplinary approach. It needs a multidisciplinary approach, and the key components include we need the physios for strengthening exercises, aerobic exercises, and range of motion exercises, which are mainly to prevent any joint contractures and maintain the flexibility. Occupational therapy also comes into action, and we need the adaptive techniques, teaching and implementing techniques to conserve energy during daily activities, and assistive devices, recommending and training in use of mobility aids or assisted devices like braces or orthotics to enhance the independence. And respiratory support, respiratory muscle training, exercise to strengthen the respiratory muscles, and assessment of breathing function, regular monitoring, and if necessary, intervention to manage the respiratory issues. What about the pain management? So pain management, we need some analgesics or anti-inflammatory medications, and we can also employ some physical modalities like heat, cold, or massage therapy to alleviate muscle pain. Orthopedic management, assessment for musculoskeletal tissues such as joint deformities or contractures, and sometimes we need then interventions needed such as tendon release or joint procedures. Energy conservative techniques I already discussed, and the important thing is patient needs a psychological support to cope with emotional and psychological impact of living with chronic conditions. We can take help from the support groups, Nutritional support, maintaining a healthy diet, regular monitoring, follow-up assessment, regular medical assessment to monitor the progression of symptoms and adjust the management strategies, and immunization, ensure up-to-date vaccination to prevent additional health complications. Medications I already discussed, assistive technologies and educational program providing information about the uh, post-polio syndrome, its course and self-management strategies. So as you can see, there is not much in the management. Mainly it is a supportive management, but you must be aware about the multidisciplinary approach and all the other departments which are needed, like we need physiotherapy, occupational therapy, we need some respiratory support from the orthopedic management as well as input from the orthopedic department. And don't forget about the psychological support as well. So this is about the post-polio. So once you have done your physical examination, then you have to present your case. So I have briefly written here. So first of all, you're going to start with the introduction. So good morning. My name is this. Today I'm going to present the case of Mrs. Johnson, a 65-year-old woman. Then you're going to do the patient introduction. So Mrs. Thompson, she has a polio during childhood, and the acute phase of illness occurred. How many years? Normally it is more than 15 years. And after a period of stability, she is now experiencing new symptoms that are impacting her daily life. And then we're going to start with the presenting complaint. The reason for Mrs. Johnson's or Mrs. Thompson, whatever, visit is the recent onset of weakness and fatigue, particularly in her lower limbs, and she reports increased difficulty with walking and performing activities that were previously manageable. And then we're going to talk about the history of present illness, how it evolved over the past years. She has noticed a gradual decline in muscle strength, especially in her lower limbs, and she describes increased fatigue, particularly after physical activity, and there is no history of recent infections or trauma. We're going to briefly talk about the systemic review, especially focusing on the respiratory symptoms. There are no respiratory symptoms of the systemic issues, and she denies any recent illness or major stresses in her life. And once you have completed your history, then you're going to talk a bit about the neurological examination. So I performed a comprehensive neurological examination focusing on specific areas. New weakness is noted in the lower limbs, particularly in the quadriceps and hip flexors. Gait is slower, and there is increased effort noted during walking. Hyperreflexia is observed, and there is spread of reflexes to adjacent muscles. Respiratory function, initial signs of respiratory muscle weakness were noted. So further assessment and sensory examination reveals no abnormalities. So this is all about your neurological examination. So just mention the positive points and try to be brief. And then you're not going to stop here. You only will stop when the examiner stops you. So to support the clinical evaluation, I ordered EMG, or I will order EMG to assess for signs of chronic denervation and retention effectiveness. Differential diagnosis, then you're going to talk. While the presentation is consistent with post-polio syndrome, I have considered other potential causes, including inflammatory myopathies and neuropathies. And then you're going to continue with your management plan. For the management of Mrs. Johnson post-polio syndrome, I propose a multidisciplinary approach: physical therapy to address muscle weakness and enhance mobility, respiratory support as needed based on ongoing assessment, pain management utilizing analgesic and physical modalities, and regular follow-up to monitor the progression of symptoms and adjust the management plan accordingly. And finally, going to conclude. In conclusion, the patient clinical representation is consistent with the post-polio syndrome, and the multidisciplinary approach aims to optimize her functional abilities and enhance her quality of life. I will continue to follow up with her regularly to provide ongoing care and address any evolving needs. So this is how your presentation should be. And remember, just continue until the examiner stops you. I put few questions here which have been asked for this case. What are the diagnostic criteria? We already discussed the diagnostic criteria. I'll repeat once more. It typically includes a history of prior paralytic poliomyelitis, a period of functional recovery after the acute phase, a gradual onset of new weakness, fatigue and or pain, stability of symptoms for at least 15 years, and the exclusion of other potential causes for the symptoms. Another question which is commonly asked, how would you differentiate post-polio syndrome from other neuromuscular conditions? So remember that post-polio syndrome, it can be differentiated by the characteristic history of a prior polio infection, a prolonged period of stability, and then there's a gradual onset of new symptoms in previously affected muscles. And EMG findings may support the diagnosis by demonstrating the chronic denervation and re-nervation in affected muscles. Another question which can be asked is, can you explain the role of EMG in the diagnosis? So we already discussed about the EMG. It is useful in post-polio syndrome to detect signs of chronic denervation and re-innervation in affected muscles. And presence of these electromyographic changes supports the diagnosis and helps differentiate post-polio syndrome from other neuromuscular conditions. How would you manage the muscle weakness in patient post-polio syndrome? So it involves a multidisciplinary approach. We have already discussed. We need physical therapy, which is essential for tailored exercise program to maintain muscle strength without causing overexertion. Assisted devices such as braces or orthotics may be recommended, and respiratory muscle training may be implemented if respiratory weakness is present. I'm repeating the things and again so that you remember these things, because post-polio syndrome normally will be diagnosed by the history. So keep on rehearsing your answers. So when the examiner asks you, all your answers should be at the, I always used to say that it should be at your spinal cord level, and you should be able to answer the questions very fluently. Importance of multidisciplinary team approach in managing post-polio syndrome. So multidisciplinary approach is crucial in managing post-polio syndrome because it addresses the diverse needs of individuals with this condition. And physical therapists, occupational therapists, respiratory therapists, and other specialists work collaboratively to optimize function, manage symptoms, and improve the overall quality of life for patient. And how would you explain the diagnosis of post-polio syndrome to the patient? So I would explain to the patient that post-polio syndrome is a condition. It is characterized by the late onset of new symptoms such as muscle weakness and fatigue several decades after recovering from the initial polio infection. And I would emphasize that these symptoms are related to the prior polio infection and not a recurrence of the virus. And the diagnosis is based on comprehensive evaluation, including the patient history, examination finding, and if necessary, supportive tests like electromyography. What is the long-term prognosis for individuals with post-polio syndrome? So long-term prognosis with post-polio syndrome, actually it varies. While the condition is not life-threatening, symptoms can gradually progress, affecting the mobility and function, and management strategies aim to optimize function and improve quality of life. Regular follow-up assessments are essential for monitoring changes and adjusting the management plan as needed. A distinguishing feature of post-polio syndrome on EMG, well, we know that the EMG often shows signs of chronic denervation and re-innervation in affected muscles, and this includes the presence of fibrillation potentials and positive sharp waves indicating ongoing motor unit activity and muscle fiber denervation. So these are the findings which normally you see in the EMG. So finally, how might you differentiate post-polio syndrome from new onset muscular disorder? I've done it before, and I've answered it before. Let's do it again. So a key differentiating factor is the history of prior paralytic poliomyelitis in post-polio syndrome with a prolonged period of stability before the onset of new symptoms. Additionally, EMG findings in post-polio syndrome typically shows chronic denervation and re-innervation patterns. Okay. So, my dear doctors, that's all about the post-polio syndrome. Remember, it's almost a spot diagnosis, and especially if the case comes in the Asian region, and if it comes in the consultation station, the diagnosis will be quite obvious. So, because patient will give the history of polio. If it comes in your neurology station, then again you should think about the polio. It will be in your differential, and going to talk about the other differential diagnosis as well, and you're going to obviously perform the lower limb examination. That's all, my dear doctors, and I'll see you in my next presentation.